Hello and welcome everyone. It's so cool again to see so many people joining from so many different locations. Myself here, I'm based in South Florida, and I saw that a few Floridians have joined the webinar already. Today's guests and co-host of the webinar is Dr. Kirsten Shepherd, who's joining us from Austin, Texas. Which is super great, and I had the chance of working with Dr. Shepherd in Austin to produce a course, an online CEU course on the topic of today's discussion and today's webinar, using CBD, what is CBD, and, in the framework of manual therapists and body workers. Dr. Shepherd is a chiropractor and also a massage therapist. So, maybe the ideal person to be speaking to our community of manual therapists and, people that are joining here today from so many different states and countries. So far I see Canada. I'm waiting for the UK individuals to join, and the Australians and New Zealand individuals to join. But it's like the topic of today's discussion has a relevance to your geographic location, right? Because it's to some degree it's a controversial thing. Some places, it's completely illegal even to to use these products. And in many cases, this the topic of discussion is very very new in terms of academic research, in terms of medical research, in terms of application research. There we go. Someone from London joined. So yeah, we're going completely international now, across the pond. So I'm extremely excited about this. I hope that you enjoy today's topic. Remember, just like you just use the chat box now on the right-hand side of the screen to mention where you're from, you can also type in any questions. We will, if it's a relevant question/comment throughout the presentation and throughout the discussion, then I will absolutely, bring it up. But if it's a question that can be asked at the end of the presentation, I'll wait till then to read it out to Dr. Shepherd, because we'll be leaving about 15-20 minutes at least at the end of the hour to read out any questions or comments that you in the audience have. So again, whether you're a chiropractor, osteopath, massage therapist, fitness professional, thank you for joining, and we hope that the presentation will be useful to you. Keep in mind that this will be recorded, and you for joining live, you get first rights to see it live here, and you'll get an email with a link to the webinar. And then later on, it will be published as well on our website, and it will be published on our social media channels. For whoever hasn't taken a course with us yet, please head to our website, when you get a chance, to www.neilasher.com for just to browse and see what we offer. We have over 115 different educational resources and CEU courses for all manual therapists and fitness professionals, so please check them out. I mentioned that very soon, probably in the next few weeks, Dr. Shepherd's course on using CBD products for body workers and manual therapists will be released. It will be a CEU course. It will be approved for massage therapists, athletic trainers, and other professions as well. So please remember to subscribe to our email updates, and please follow us on social media. It's worth it just for the huge amount of free material and free tutorials, webinars, podcasts that we publish on a regular basis, almost daily. So please check out our YouTube channel, Facebook, and Instagram. We are expanding the international presence today with a participant from Costa Rica. So Marcela, I'll give you a shout out. Thank you very much for joining. And we are 5 minutes past 1 p.m. Eastern time, and we are good to go. Dr. Shepherd, thank you for being here with us. The stage is yours, and I'll be here with you and loop back into the discussion once you finished running through the presentation. So good luck, and thank you for being here with us.
Thank you. Good afternoon, everyone from the U.S. and abroad. Thank you so much for joining us. I wanted to share some information on this course just to give you a little overview about CBD and how you can incorporate it into your practices. The first thing that I like to do is kind of talk about what's going on right now in the healthcare realm, especially here in the US, that makes this need to educate ourselves and allow for other options for our patients and our clients. The objective today is to understand how cannabinoid-based therapies align naturally with manual techniques to enhance therapeutic outcomes. If we just look at the top reason individuals come and visit us in our practices or are seeking care, if we look at arthritis just in America, nearly 1 in 4 adults, or 58.5 million people, have been diagnosed with arthritis. We have over 23.7 million people who have physical limitations that affect their ADLs, or activities of daily life. What are the current choices that we're offering these clients and patients for help? Well, in the US, primarily our focus is on pharmaceuticals. And every year in the US, more than 4 billion prescriptions are dispensed. Now, we all know as musculoskeletal specialists or neuromusculoskeletal specialists that this isn't solving the issue. It's actually creating more of a problem. If we look at prescriptions per capita in the US by age, this is data from 2013, look at the age group that is getting the most prescriptions. That's going to be our seniors. And if you ever go to any pharmacy and just look at the lines and how busy they are, how many neuromusculoskeletal issues are being resolved by pharmaceuticals? Mostly none. The options that we are currently educating our patients on, if you look at advertisements in the US, you're mostly going to see the NSAIDs, Aleve and Advil, those commercials with someone jumping around, letting people know that, the reason why they have pain is because of that lack of a pharmaceutical in their system, which is not true. And we know that turning off those nociceptors or those pain receptors is not the answer. That's like putting a Band-Aid over your check engine light. We just look at side effects from Advil, and this is from rheumatology.org. We see stomach ulcers and bleeding, high blood pressure, fluid retention, kidney problems, heart problems, skin lesions. This was the cover of Time magazine back in 2015. This is before we even started talking about the opioid crisis, but we're talking about how it's created this largest addiction issue in America. The US consumes 75% of the world's medications, but guess what percentage of the world's population we are? We're only 4.25% of the world's population. Just think about that for a second. What are we educating people on when it comes to outcomes and improving quality of life? If you watch commercials here in the US, you'll see ads for alcohol. You'll see ads for pharmaceuticals, that's number one, and fast food. Most of the international counterparts, you're not seeing that. What you're actually seeing is lifestyle. You'll see fashion, you'll see financial investing and travel. What are we doing right now? And just looking at that senior population again, is we're telling them the reason why they have these issues is because they have a lack of some certain substance in their system that only modulates pain, and it modulates it temporarily. Cortisone injections. How many of you on a daily basis see individuals who are coming in for relief and care that let you know, oh, I had an injection, the first one worked, the second one, didn't last that long, the third one didn't do much? Why are we limiting? And if we just look at arthritis, osteoarthritis in the knee, why are we limited to 3? Because it's not solving anything. The side effects of cortisone injections: thinning of the bones, osteoporosis, easy bruising, weight gain, increased blood sugar, high blood pressure, cataract formation, and thinning of the skin. And these are individuals that are already predisposed because of their age to a lot of these conditions. The biggest issue with cortisone is that it eats your joints. So why would we recommend several series of something that's just causing more destruction? It's time that we change our thinking and provide more resources for our patients. And I hope no one is eating lunch right now, or this is making them a little uneasy, but this is what a total knee replacement looks like. So we're giving options of drugs and surgery. If we look at a replacement, we're looking at blood clots and infections as far as those risks. And one of my favorite scientists doing the same thing over and over again and expecting a different result is Einstein's definition of insanity. And yes, we are living throughout insane times. And I often speak about the sick care system that we have here in the United States. I've spent the last 25 years of my life as a massage therapist, and the last almost 20 as a chiropractor. I've seen the different options that haven't been solutions. We're just managing things. Let's talk about looking at things differently. First question I wanted to address is, what are cannabinoids? Cannabinoids are natural compounds of cannabis sativa. We have over 100 cannabinoids that have been discovered in the plant. The most common that many of you have already heard about are THC and CBD. But again, there are over 100 cannabinoids, and on a daily basis, new ones are being discovered, and how they interact with the body are being discovered. Why is there an importance, and what's important about discussing CBD with your clients? Well, if we look at recent studies, 70% of patients say they do not discuss cannabis usage with their primary care providers because they don't trust their providers are a knowledgeable source. 70% of patients. The reason being is the limited education that is provided on the endocannabinoid system, and we'll delve a little bit deeper on that in a few slides. But there's also a limited education when we have medical doctors who are learning about the nervous system. And in our medical schools, in our chiropractic schools, in your massage schools, most often there is no mention of the endocannabinoid system. And just like we have a nervous system, a muscular system, a skeletal system, there is a endocannabinoid system. So hopefully you'll be excited to find out some of the magic about what the system does. Older adults are also reporting using cannabis to treat health conditions. So our patients and clients are seeking safe and natural alternatives, and discussing this with your clients, whether or not you decide to incorporate it into your practice, is something that we should do to help guide them in their decision making and help them choose products that are not only beneficial, but that are effective and that come from reliable sources. When we look at CBD or cannabidiol, it's the second most active ingredient in cannabis sativa. It's an essential component of medical marijuana. It's non-intoxicating. Oftentimes people call that non-psychoactive effects. It's not going to have any type of effect when it comes to altering their personalities or altering how psychoactive they may feel. CBD, which is one of the biggest questions I often get, is what's the difference between hemp CBD or marijuana CBD? And CBD can come from both hemp and marijuana. If we look at THC versus CBD, what's the difference? THC in the United States is only legal in select states and in certain countries. And I know we have quite a few international individuals that are joining us today. It is intoxicating and it can cause anxiety. CBD, on the other hand, is legal in all 50 states and most countries. There are certain states that have limitations on whether or not the CBD can contain any THC. California most recently changed their laws in which they're only allowing products for sale with CBD that have 0% THC. I believe Kansas is another state. But it's very important to make sure what's legal, what the laws are in your areas before you start looking at products. The CBD is non-intoxicating. We mentioned that before, and it can relieve pain as well as reducing inflammation. What's the biggest difference in these two chemical makeups? And if we look at the chemical makeup of THC versus CBD, very, very similar. There's actually, a couple of double bonds that are different when we look at the structure. How do cannabinoids work? So cannabinoids work by regulating how the cells communicate with the endocannabinoid system, or the ECS. These cells regulate how information is sent, how information is received, and how the messages are processed. The ECS, or the endocannabinoid system, is actually a complex system that was discovered in the 1990s, and it regulates a range of physiological processes. We're looking at pain perception, inflammatory response, sleep, mood, memory, reproduction, and fertility. So the ECS, endocannabinoid system, exists and is active even if you don't use cannabis. If we look at the location, there's two different types of receptors. We have CB1 and CB2 receptors. And CB1 receptors, you're going to find that in the brain and the central nervous system. CB2 receptors are mostly in the peripheral organs and the cells of the immune system. So what's interesting about CBD is CBD can both inhibit or depress these receptors, and they have the ability to also excite these receptors. So your endocannabinoid system, just like the nervous system being the master controller of the body, the endocannabinoid system is the master regulator of the body. It maintains homeostasis. We can look at locations of those receptors. Again, you'll see them in the brain, the lungs, the vascular system, the muscles, every single body system. We see the location of the CB2 receptors, spleen, the bones, the skin, the immune system, the liver, bone marrow, and the pancreas. When we look at therapeutic applications and the role that the endocannabinoid system plays in body work, pain relief, we're reducing inflammation, it's desensitizing pain receptors, and that complements manual therapy and massage techniques like deep tissue or trigger point therapy. If you're looking at stress reduction, the effects combined with the massage techniques help regulate stress responses and promote relaxation. You also have enhanced recovery. It accelerates post-injury recovery by modulating the immune responses and reducing oxidative stress, which is very beneficial to athletes, whether it's amateur or professional athletes. It can enhance recovery time. If we look at some of the research, there was a study published in Nature Reviews Neuroscience that highlighted the endocannabinoid system's central role in stress regulation, showing how cannabinoids like CBD can target the ECS components to reduce anxiety and cortisol. Again, looking at immune modulation and inflammation. Research study from the Journal of Pain from 2021. That study emphasized how the ECS's ability to modulate immune responses and reduce chronic inflammation, which aligns directly with the therapeutic goals that we as body workers and manual therapists have. One of my favorite components that the ECS and CBD provides is neuroprotective properties. So there was an emerging study in Frontiers of Pharmacology in 2020 suggesting that CBG and CBD protect against neuronal damage. So it has both neuroprotective and neurodegenerative benefits. So it can help not only those cells to protect, but for them to regenerate. So neuroprotective and neuroregenerative properties. When we look at the ECS synergy with different techniques, Swedish massage, you can stimulate the nervous system with components of the ECS, and our goal with most Swedish massage is reducing stress and improving mood. When we look at deep tissue, if you combine CBD topicals targeting the chronic pain and the inflammation, helps you go a little bit deeper with the muscle layers and then fight off that irritation that we've caused as part of the healing process. For those lymphatic drainage specialists, you can enhance detoxification by reducing that inflammation and balancing out the immune system. Really great for those patients with, fibromyalgia, trigger point therapy. You can desensitize those overactive pain receptors, which is going to make those pressure application points less painful for your clients. If we look at practical applications and different types of products, I just wanted to touch on what is out in the market right now. So there's tons of different types of products. You'll see topicals, oils, balms, and patches, and we'll talk about this a little bit more in another slide. That allows for localized activation without the systemic psychoactive effects. There are some products that combine both THC or low-dose THC and CBD, and we go a lot more in depth on the science and the response, the biological responses in the course. But you also have client education. We need to explain the role of the endocannabinoid system and how it supports recovery and relaxation. It's natural. Cannabis has been used as a medical treatment throughout civilization that's documented for over 5,000 years. It was just in the last 85 years that we saw the deregulation or the prohibition of cannabis. Just here in the United States alone, over 50% of our medications actually included cannabis. And yes, there's a lot of misinformation, but now we're seeing it coming back on the rise. And there's been research into cannabis that's been happening for years. We also want to look at custom treatments. You want to make sure that you're able to adjust the cannabinoid use based on the client's needs. Anxiety relief, chronic pain. We'll discuss more in the course on the different types of cannabinoids, the CBG, which is really good for guts, the CBN, really good for the neuroprotective properties, even better than standard CBD. So we'll delve more into the different types of cannabinoids and how the research is showing us what it helps with. THCV for all of those, that are looking for weight loss options. THCV is a cannabinoid that's been discovered to have properties that can help suppress the appetite. So we look at pros and cons for clients. Pros, of course, we've talked about the inflammatory reduction. So it's beneficial for clients with chronic conditions, just like, the initial slide when we're discussing osteoarthritis, very beneficial for chronic conditions, pain management, musculoskeletal conditions. This is all our wheelhouse. It's non-addictive. It carries a lower risk of dependency. And it's versatile. It comes in so many different forms: oils, creams, patches, capsules, and edibles. So there's flexibility in administration. You don't have to just smoke to get relief. If we look at a little bit deeper, going into CBD products that are available on the market, you have the capsules, the tablets, and soft gels. These usually offer options that are convenient for consumption, and it makes it a little bit easier when we compare dosing with tinctures and integration. So for a lot of anxiety sufferers, or I work with a lot of therapists and recommend treatments for children that have ADD, ADHD, or even adults. We're looking at those college students that have generalized anxiety disorder. It takes the guesswork out of it. So being able to kind of look at your particular patient or client and recommend things that are going to fit into their life. Creams and lotions, amazing to use, easy to integrate into the therapies as you're doing them. It allows for the targeted relief of those sore muscles and those inflamed joints. They're usually infused with other ingredients like menthol or arnica to help enhance the efficacy. But creams and lotions make it really easy to apply, and they can reapply as they need. I have a lot of patients with plantar fasciitis that love to use different types of CBD salves. And for those, I live in Austin, so it's a city where it's known for its music. And for those individuals that love wearing heels to different performances, they're like, I just put a little bit of that salve on the bottom of my foot before I go out, and I'm good all night. So definitely very beneficial for multiple uses, depending on how you'd like to use it. Edibles, CBD infused edibles like gummies, there's beverages, there's chocolates, there's, lollipops, you name it. There's also teas, but they offer delicious options and a simple way to incorporate massage oils. You all already most likely use those. And combining the benefits of CBD with those just enhance the reduction of muscle tension and relaxation. Roll-ons are really good. We find a lot of our athletes and male patients enjoy using roll-ons because they provide a convenient use to directly apply it to the skin. And usually if someone has low back pain, which I know we all see a lot of those, there's definitely some great options for them, and it's portable, so it allows them to really target those specific areas. I've also noticed that most women, we enjoy massaging things and pampering ourselves. So salves and creams are amazing for that. And a lot of the men like something that's quick. And with the roll-ons, you'll notice that they have generally a faster effect to them, especially if they've been combined with menthol. Tinctures are the highest selling CBD product that's on the market. I think the last research that I saw said that over, I think, $762 million last year in CBD was from tincture products. Those are usually taken sublingually. They allow fast absorption, amazing for systemic relief. So for those individuals with lupus, they have total body issues. I like to recommend products and have patients with autoimmune issues, use both a oral product and then a topical because it helps manage their flare-ups. Transdermal patches and tape, those seniors really love those, especially for that knee or that back pain, because they can apply it directly to the skin and it's going to provide them with a continuous dosage throughout the day. So they're easy to apply, it's discreet, they can put it on and go about their day, and they're getting 8 hours of steady dosages of CBD. There are side effects. So when I see individuals speak about CBD, there's a few things that you do need to know. Yes, CBD can cause side effects. Typically what you see with that is dry mouth, diarrhea, reduced appetite, drowsiness, fatigue. It can interact with blood thinners. On the second hand, it can also increase the appetite. And then depending on what type of cannabinoid, there are some products that give you more of an awakening feeling. The THC side effects, you'll see increased heart rate, coordination problems, dry mouth, red eyes, slower reaction times, memory loss, and anxiety. The things that I want you all to take away is considerations. One is, what is the objective for this individual that is looking to incorporate CBD into their lifestyle? Is it just a localized pain relief? Are they trying to reduce stress? What's their career? Because, and I think I did see somebody put it in the chat, a lot of individuals are concerned, about their lifestyle and their career. They don't want to lose their job, for popping hot on a urinalysis or a drug test. And so for those individuals that are open, if you're recommending a product that has CBD, then you would want to make sure that those products have 0% THC. You better use a company whose products are third-party tested, that they're actually able, that it's a verifiable resource, because you cannot put that person's career and livelihood on the line. I know at one point, the NCAA actually would only allow CBD for athletes with seizures. How many professional athletes are there that have seizures? None that I know of. And so we saw what happened with the young track runner during the Olympics. She wasn't able to run, but she was able to come back, and she was using CBD for recovery. You have to look at the method of delivery. You also want to look at those product sources. Certificate of analysis should be provided on every single product. You want to look at the types of products that you're using. Is it a broad spectrum? Is it a full spectrum? If someone is a law enforcement officer or a federal employee, you definitely don't want to use a full spectrum product with them. You want to look at dosages. You're not going to recommend the same amount of use, and everything's individualized. So you can't just have a cookie cutter approach to everything, because just like with your sessions and your treatments, there's not one thing that works for everyone. And I always recommend clients start slow and low, because you want to see how your body responds. Everyone's body is not going to respond the same. And then what's the frequency of use going to be? I saw there were a few questions in the chat, and Danny, if you want to help me kind of manage that.
Yes. So first of all, thank you for all of that. That was really fantastic. So we have a few comments here and a few questions which I will navigate through. But first, before I look at those, and I'll just give these few minutes here to anyone that is here online with us to this is the time to think of any comments, questions you might have, and type them in, and and we'll discuss and read them. So please do that. But first, before we jump into it, Dr. Shepherd, I wanted to ask you just from a practitioner standpoint, how did you get involved? If you don't mind sharing, how did you get involved in experimenting with these products, and how long have you been experimenting with these products? And kind of the backstory to that, and if it's from the chiropractic side or from the massage therapy side, or both.
Neither one of those sides is how I began experimenting with the products. I actually started experimenting with the products back in about 2015 when my father was diagnosed with mesothelioma, which is the asbestos cancer, and chemotherapy and radiation had him nauseous. He had a lack of appetite, and he was in a lot of chronic pain. I've spent part of my life living in Los Angeles, so I knew a little bit about compassionate use. I knew that they had legalized recreational, but it wasn't until I had that experience with my dad. So in 2015, California wasn't legal for rec yet. They had the medical marijuana. And it wasn't until I had that experience with someone close to me, daddy's girl, who I saw suffering. And if he took those opioids that they gave him, my dad was literally just sleeping. He couldn't interact with us at all. So I started reaching out to my friends that were in California, a few friends that were in Colorado. And I was like, hey, can you help me, find some things? I started looking at compassionate use, and I started looking at cannabis because I knew, there was a lot of buzz around how cannabis was helping these cancer patients. The more and more research that I began doing, the more I started learning that THC was just one component. It was actually the CBD. And if you combine the two, yes, you can get the entourage effect. And so my father, his quality of life improved. I had different types of CBD samples that were sent to us. And what we discovered was, number one, his pain was reduced, his appetite came back, and he was able to interact with us. So the last few months of his life, or last year, because once they're diagnosed, they only give them a year, but his last year, his quality was enhanced by CBD. And so I wanted to set out to help as many people as I could and research and learn about and find out about products, and also finding out what's the difference in these products, because CBD is available everywhere now. You can go to a local convenience store and they might have CBD CBD there? What's the difference between what they have and some of these specific CBD scores? And I learned all CBD is not created equal. And then once I discovered by going to different conferences that they were actual medical doctors throughout the world, a lot of the research has been done in Israel. We know Canada has been on the forefront, but a lot of the research that has been done right here in the United States has been suppressed. Why are we suppressing an herb? And I believe it's about greed. So that was some of the things that kind of motivated me through my journey, and understanding how, as a massage therapist, the skin is the largest organ. I started utilizing different products and rubbing them on my father's skin because he did not like the taste of the tinctures or the oils. And I really started discovering more of the CBD versus the THC because my father, being, a teenager in the 60s, did not like the psychoactive effect that the THC products were giving him. And he said, I'm too old for this stuff. And he didn't say stuff. Back in my younger day, back in my hippie days, this would have been cool. He's like, I'm way too old for this. And so I started really trying to figure out, why is this working? Why is this making a difference where all these other products aren't? He's not responding to this medication that they're giving him that's supposed to be helping. And who's trying to keep this information? So I'm one of those that the more I feel like individuals are trying to prevent me from knowing about, the more I'm going to research and find out about. And that's exactly what I did.
And how long would you say you've been really, experimenting, researching, and utilizing these products?
Since 2015.
Wow.
I started in 2015.
Yeah, and do you mind expanding on also your, the course that we produced together is in partnership with the SCC, the Society of Cannabis Clinicians. Do you mind just expanding on, their mission, what they're doing, and your relationship with them?
So I am a member of the Society of Cannabis Clinicians. It is such an amazing organization that has been around for over 25 years. They are on the forefront of educating the medical community and providing resources and true information. There are so many docs throughout the United States that are saving people's lives and changing people's lives with cannabis. There's a doc that presented last year, and they do have seminars and conferences. So last year's conference, actually year before last, the first conference that they had was at UCLA. It was sponsored by their neuroscience department, and one of the presenters shared the information that on the research that they're doing to help women reverse endometriosis utilizing cannabis. You hear so much, and it's such a diverse group. Like from this year, actually last year, it was in October, and it was at the University of Maryland School of Pharmacy. And they had one of the pharmacists talk about, it's not just an endocannabinoid system. He showed us research, and it's actually an entire microbiome. So if you're a science geek, I'm like, definitely check them out. Their memberships are not expensive. Many of the members have written different types of curriculum, which is amazing. But most importantly, they just share a passion for helping patients heal and improving quality of life and causing the least amount of harm. And these herbs, they also, talk about psychedelics and what they're seeing with mental health disorders. So it's just really exciting to be a part of that. And that's how, kind of develop this course with the continuing education, is how do we reach more individuals, and how do we make sure that the materials and the information that is provided is factual, and provided to those areas. How do we fill that void that the medical schools are ignoring?
Fantastic. So good, and everything they do seems also, you mentioned that being on the cutting edge. It's also like they very much incorporate different perspectives from different professionals and, in different professions in different parts of the world. So diversity of research is encouraging, and I'm also excited for our partnership with them to keep exploring this topic, because right, it's like you mentioned how ancient this all is, but we're discovering, because only now a lot of new research projects are being implemented and more money is being thrown at it, then we're discovering new things, which is always exciting.
Absolutely.
So, so there's a few questions here, and I'll start going at them. So you mentioned, so if someone is worried about, like, drug tests and things like that, if there's 0% THC, then no one should, be found positive when it comes to, a marijuana drug test.
If it's a verifiable product. So, you have to make sure that the source of that product and that COA that you have, and that you really can trust that company. Because right now it's kind of like, some people say, oh, this is all natural, but then you read the label and it's really not.
So what are some ways, like, to best ensure product integrity when one purchases something, in your opinion?
Research the companies that you're purchasing those products from, test them. I have tested products myself, and that's one of the things that I wanted to make sure that I was able to never affect someone's livelihood and cause them any type of harm. So I literally took a few products and went and just paid for a test. You can also use some of the over-the-counter tests if you want to, but I think that knowing your source of products and making sure that they're verifiable, that they can say 100% THC free or 0% THC. I wouldn't trust a product from the convenience store to and recommend that for someone who has to be concerned about their livelihood.
Yeah, great. And then another question here from Heidi on, when someone comes in with a specific, pain point or ailment, should the CBD product be used, when talking about a massage, in that specific location, or just in general for full body use?
If they're looking, and that's up to, like, we all have our own art when it comes to how we practice. And so that's up to you as a provider. If, for instance, someone comes in and I know that they just have high stress and they need to relax, I might use, an oil and use that more systemically throughout their body. If someone just has knee pain or their low back is hurting them, I may just use a little bit of CBD product in that area. So it just depends, again, on what it is you're trying to accomplish with that patient. But some products that you can definitely utilize in other multiple areas. But why? What's the overall goal? And localized treatment is perfectly fine.
Great. And then another question here, which maybe you'll give a similar answer to, because it does depend on one's, way of operation. But in terms of amounts, because we are talking about, a specific dosage, right, of potency of every product. So one is asking, do you just need, like, on a massage, like with regular, oils and lotions, just enough to lubricate, or are you looking for a certain amount?
So my personal practice is, I know the products that I'm using quite well. And if I'm using, for instance, a salve or an oil, I can incorporate that into another carrier oil. I did notice that someone had commented that, a lot of the massage oil manufacturers are now selling oils that are infused. That's perfectly fine, but a little bit can go a long way. And I don't know exactly, I like to know the sources. So the manufacturers that I work with, I know exactly where the products are coming from. I've gone to these farms, like I've done a lot of research myself. So I know who the cultivators are. I know who's processing the extractions, and I know I can trust these products. So if I have someone who has a product that says there's 1,800 milligrams in this jar. Most people, that's just going to mean nothing too. But what does that mean? If you have a 2 or 3 ounce jar, that entire jar should have 1,800 milligrams of CBD in it. Another sidetrack when you're looking at certificate of analysis. Some companies will just send you a certificate of analysis that tells you the total cannabinoids. Some companies will give you the information on pesticides. So a better company is going to tell you not just the cannabinoids, they're also going to tell you what the pesticides are. Another thing that I learned was not all products on the market are actually insured. And so as a chiropractor, I know that my malpractice insurance doesn't cover products that I sell in the office. So if there's a recall, if someone has some sort of effect, I don't want to be the one responsible for putting my license on the line for it. So that's another question is if it's really a reputable product, I believe they're going to have product insurance, and it's very expensive. Not all of these companies do. And I forgot your question. I think I got off track on that one.
Yeah, no, but just
Did I answer it?
no, so in terms of amounts really to be used, and you mentioned,
Yeah, it's going to
yeah,
vary from individual based on the product
yeah,
that you're
yeah.
using and
But
their
in
tolerance.
some cases, could it be more than like just enough to lubricate, like you would with a plain lotion or oil?
It can be depending on, the person's response. So I would say test it out, try a little bit. You can start slow and low. I mean, most great products are going to have some sort of effect, I would say, in 15 to 30 minutes. It may not be immediate, but again, we're looking at the individualized person. So it's like somebody, you may have neck pain. I could massage your neck. Someone can massage my neck. We may both be suffering from neck pain. You may feel results instantly. And, I may be sore right after. It may take me a little bit longer to feel some results. And it's going to work the same way with your body and when you're incorporating products. I would say err on, the side of testing it out. If you're new to this product and considering offering it, to get some of your friends together and test it out, but also know, similar to alcohol, that everyone's body is going to process things differently. And so, you can try a little bit, test it out. When I typically go to events and people want to sample different products, I'm like, here, try a little bit of this, put it, where are you putting it? What's going on? Okay, come back and let me know. So you can always test it out beforehand and learn those. And I think the more experienced you become with your products that you're using, the more experience that you are with the products that you're using, the more comfortable you're going to get to be able to kind of customize that based on the individual's needs.
Awesome. So another question here about the um, the benefits of CBD products. Is it something that needs to be used multiple times a day? Or I think you touched on this a little bit, so not necessarily, but could it be sufficient? Could you see benefit from not multiple times a day? There's a concern here by maybe CBD companies trying to sell you on to use it as much as possible. in order to see benefit?
That's a great question, and it depends on the product. So, some topicals, if you have someone with chronic pain and they want to use a salve or a roll on, or even looking at an athlete with their post performance recovery, they may want to put it on a couple of times a day if they have that inflammation, if they're feeling pain. It's easy. Yes, shake it up, reapply it. They may not need to use it multiple times a day every single day. And especially if they are seeing another healthcare provider to help them achieve their goals, like a manual therapist or a body worker, they definitely shouldn't need to do that multiple times a day for several days. But if you think about it, it's just like other topicals that are on the market. There's some that have been well known in the massage community that, you all can probably think of the names of right now. Yes, some of those you apply multiple times a day. But then there are other tools. For instance, if they're taking something systemically, they might not need it multiple times a day. Or if they're applying a patch or utilizing K-tape, that's giving you 8 hours of continuous relief. So it's going to depend on really, is it an acute issue? What's what's going on? What are you trying to achieve with it? For most individuals that use it, for topicals, it's on an as needed basis. So it's just like, any other topical analgesic. You may want to apply it. If it lasts 2 or 3 hours and you start feeling that ache come back, then they can reapply it. But it's really going to depend on the products, what you're using, and what you're trying to achieve. And we delve a little bit more in the course on some of the uses and with some case studies as well.
So there's a bit of a technical question here. So you mentioned that we want to look for 0% THC products, but is there still a bit of THC in there in order to activate the CBD? Because there's a comment here about the necessity of THC present in order to activate the CBD benefits.
That's completely false. That's actually the entourage effect. So there is research that shows there's a benefit when you combine the CBD and the THC. But there are several products that I've been using for years that have 0% THC that are quite effective, very effective. So that is not true. And so for CBD in the United States, for something to be classified as CBD from the US Farm Bill, it has to contain 0.3% THC or less in order to be classified as hemp CBD. So the highest it can go, there might be some that have 0.2% THC. But for one of those, and what we were talking about earlier, we were discussing someone's livelihood. So if there was that federal employee or that educator or that law enforcement officer that wanted to use some CBD to help, versus using an over-the-counter medication or some other product, you want to make sure that if you are recommending a CBD product for them, that it is 100% THC free. There is a way to guarantee. There are companies that have products that stand behind them that definitely are 0% THC. But if that is not a factor, then I highly recommend, utilizing the products with the THC. It's still not going to make them hemp-based CBD products with THC, or it's still not going to make them have a psychoactive effect because the THC percentage is so low. But that entourage effect that they can have by combining the two can help enhance those objectives of helping with the inflammation, the pain modulation, the neuroprotective and neuroregenerative properties. You do not have to have THC in order to get results if it is a great product. Good question.
Yeah, excellent. And so the last question here that I'll read, and then we'll wrap things up, which I think is a good one. In terms of communication with clients, when you want to introduce a CBD product with a client, how do you recommend best communicating it? Because it's one of those things that one could easily. I have a Siri speaking to me in the background here, so it's a computer. Everyone, I apologize. But communication with clients, because they could easily be inflamed by it, or scared of you using such a thing with them because of the reasons that you mentioned. They might associate it with the psychoactive elements of the drug.
Absolutely. That's a good question. So, one of the things that I like to do is ask people what they think about CBD and have they heard about it. Like, if you just start, the question off, so many individuals are already utilizing these products. I think you'd be surprised. And I can give a quick example that I thought was really funny. One of the elders at a church that I frequently attended one of the healthy happy hours that I sponsored, where I'm like, everything you want to know about CBD, come ask the doc, And when I explained that, these products, have low THC, they're not, going to get you high. And we'll talk about Delta 8, Delta 9s, which are still hemp products more in the course, that can actually give you those psychoactive effects. But this lady actually booed me when I started saying that. And, she's like 87 years old, and I was completely shocked. But you never know what people's experiences are. It's been used for years, throughout the world as a healing resource for health and well-being. And you'd be shocked at how many more people are open than you think. But if someone just said no, because they're not interested, don't be offended by it, but I think we at least have to start by having a discussion. Have you ever used, like, that's one of the questions when I do consultations that's on, my form is, do you use cannabis products? People are going to be honest on those forms 99% of those times when they come and see me. And we also, we'll discuss, okay, so where are you getting these products? What are you using it for? And then you can have deeper conversations. Or if they say no, that's okay. You know where they stand. Oftentimes there's been events that I've been invited to speak to, but then when they hear the topic that I'm discussing, I'll be disinvited. I don't take that personally. I just think it's a disservice, to that community or that group. And you have to think back, especially in the US, which is where the ripple effect happened. All the misinformation that happened, 85 years ago is horrible. And so many people are still having that, oh, that's weed. Oh my gosh, I'm not going to try that, because they've heard negative things and they remember reefer madness or all this propaganda about what marijuana being the gateway drug and this and that. But that's not true. It's so much better, less toxic, has so many benefits, and we're just now getting to open the envelope and discover the healing properties and the amazing capabilities of this plant.
Awesome. So thank you. That was a great answer. It's obvious here in the chat that people really appreciated your presentation. So I'll take this opportunity to thank you. I'll wish you a great weekend, and I'll remind everyone to check out the website www.neilashen.com. I'll add it here as soon as we're done. I'll add it here in the chat box. In the next couple months, we will be releasing a large, course on the topic discussed today, getting into all the multifaceted areas of utilizing cannabis for all different types of body workers and all the different strains and all the different history and the science behind it. So please stay tuned. Follow us for our email updates and follow our social media accounts. Thank you for joining us from across the pond in the UK to Canada to so many different states in the United States. Thank you very, very much, and please keep an eye out for our next webinar. And I believe there's a few questions here about recordings and everything. You will receive an email with the recording link, and if you need anything else, you can always reach us at support@neilasher.com, which I'll also add to the chat box as soon as we're done here. You can always, request things, communicate with us, schedule a call with a CEU advisor, request a certificate for attending one of these webinars as well towards your CEU hours. So thank you, everyone, very, very much for joining. Have a great weekend. And Dr. Shepherd, thank you again. It was fantastic. Always a pleasure speaking with you, learning from you, and working with you.
Thank you. It's been a joy, and thanks everyone for joining us.
Bye-bye.
Goodbye.